case, you may not know this, but Mom saw that you didn't move for a while, and then it took you maybe 10 to 15 seconds before you started to move around and feel like yourself. And so you haven't vomited. Do you think he's acting his usual self?
Yeah.
How do you feel overall?
Okay.
We have a couple of options for us.
Okay.
And I wanted to chat with both of you about what those options might be. And I just wanted to start off by talking about some of the differences between concussion and a more serious brain injury that might cause bleeding in and around the brain. And most people with a concussion may have like a headache or difficulty concentrating and those sorts of things. You can get symptoms from it, but that is something we can deal with a bit later. What we're concerned about when you come here is, do you have something more serious? And like when you got smacked against the board, was that hard enough to cause bleeding in and around your brain? That out of 100 hockey players like you who have had the same thing happen to them, you'd have one who had an injury that's bad enough to cause bleeding in and around the brain, and 99 who didn't. If you were to have this more serious injury like bleeding in and around the brain, it might require a stay in the hospital or a surgical procedure to remove the blood. I wanted to introduce to you sort of a bit what our options are. So the first option is to get a head CT scan. And Nick, what that would involve would be you lying down on a table like this. It would just kind of scoot you in and out of this donut appearing thing here that takes a nice picture of your brain.
All right.
The other option is for, after a period of, I said, 2 hours, to go home and for you to watch him. And here's what you might watch for. So the first one would be he's difficult to arouse or his alertness decreases.
Okay.
Another option would be if he just continues to complain of a headache. He starts to vomit. If he has difficulty talking or doesn't looks at you and says like, "Who are you?" And those would be the reasons to bring him back here, so we could take another look at him and consider to get a CT scan. So those are the two options. Both of them will give you the same diagnosis if there was nothing serious.
Okay.
This one is immediate, and this one just takes 1 to 2 days to be sure. So the next section is just a little more information that's comparing these two. CT does involve exposure to a small amount of radiation. The head CT, depending on your medical coverage, it may cost you a little more or it may not. And then in terms of potential downsides, so anytime we get an imaging exam or a picture like a CT scan, we may find something that says, "What's that? That's kind of weird," but it's completely unrelated to why he got a CT scan, and that may require like further and further tests down the line.
Okay.
Whereas if you decide to take him home and watch him and he develops one of those symptoms, then you need to come back and be seen again.
Okay.
And here we just invite you to participate, given what we know now. What you might consider would be your choice. So this has been a lot of information. In the process of going through this, I'd like to give you a few more minutes to think about it.
Okay.
And so why don't I leave this with you? I've included on the back of this a number to call, and that's for you. And I'll come back in a few minutes when we come back and observe him and see if you have any further thoughts, or if you want to call your husband and talk it through, or the two of you want to talk it through.
Okay, sounds good. Thank you.